Welcome to JMR Talks. Today we'll discuss about employees' mental health. Gone are those days when our nation used to focus on physical health. Thanks to the pandemic, employers were forced to focus their attention on employee mental health. Now, what is mental health? When we talk of employees' mental health, we refer to their cognitive, behavioral, and emotional well-being. So, mental well-being and mental health. Now, why it matters? Because the mental health determines how they think, how they feel, and how they act. There used to be a saying called, a sound mind in what I call a sound body. So, unless until they are physically, mentally, psychologically, emotionally are well, they will not be able to what I call give their what I call best. In other words, employees' well-being lays the foundation for effective functioning. In a competitive world of today, where the talented human resources alone could provide the cutting edge, given the fact that all other resources are either available, accessible, or affordable, our nations need to pay attention to the what I call employees' well-being. But why employees' mental health or employees' mental well-being has become an issue? It's not that there were no mental health related issues before. Yes, there were, but the pandemic and the rising inflation, the social justice issues, and the growing what I call global conflict, it created what I call stress, anxiety, disorder, burnout, and post traumatic stress what I call disorders. They are on the rise. They are increasing. For instance, as per the latest survey by corporatewellnessmagazine.com, around 31% of the respondents they feel that their mental health has what called declined. For their survey, they have picked up around 1,000 full-time employees and around 250 employee benefits what called leaders. So what they found is that number one, employees' mental health crisis is worsening. That means it's going from bad to worse. But at the same time, when the healthy sign is that most of the employers are prioritizing workforce mental health. That means they started, what I call, moving away from physical health to what I call the mental health. But why to care, for this, what I call, employees' mental well-being or mental health? When we take care of, employees' well-being, that is what I call their mental health, the talent retention, what I call, improves. Their productivity goes up. And if you take overall, what I call, picture, you'll have improved what I call business outcomes. Excellent. So employees' well-being or employees' mental health is what I call need of the order. But how to go about? Where exactly to start? Number one, let's prioritize psychological safety. An environment where people can freely express what I call their feelings, their anxieties, their concerns, because we know that till today, so far, mostly mental health related issues are sharing, mental health related issues is treated like what I call a taboo, social taboo. So let's have one-to-one meetings. Provide employees educational opportunities wherein they can what I call learn more about mental related, health related issues from their peers, etc. Secondly, expand the benefits. Have an what I call comprehensive employee assistance program, provide them membership to what I call meditation and other what I call mental health initiatives as such. And the most important one is that let us not be afraid to speak up. Now, for instance, during the what I call pandemic, one HR manager found that there were two outstanding performers. But while one outstanding performer continued to be a what I call outstanding performer, the other outstanding performer has become an average performer as such. So when they dug deep, they found that the outstanding performer was almost on the verge of burnout. Then the HR manager, along with the what I call concerned, the line manager, draw up a schedule in such a way that the burnout is could be avoided. Now coming to the second case, when they dug deep, they found the employee recently lost his wife and had to take care of his children who are at home. That means the work-life balance has become a bit tough for him. When the HR manager in liaison with the what I call line manager could drop a schedule whereby the employee could take care of his responsibilities at home as well as at the work. I mean, the situation could be what I call saved as such. So in other words, the employer should not hesitate to what I call communicate. But before we go further, there are certain things what I call to note. Number one, employer should make a note that employees' mental health crisis is worsening. So it's time they take notice of this and act accordingly. Number two, employers can break down barriers to care. How we do that? You communicate, try to understand their concerns and act accordingly. Third, some of the employers, they overestimate their benefits ability. They feel, okay, yeah, we are providing so many benefits that take care of what I call mental health and all that. But still, there is a huge gap. Now, comprehensive medical health or mental health, sorry, is a requirement. It's not a perk. Let the employers not think that comprehensive what I call mental health is what I call is just like a perk. No, it's a requirement. It's a sine qua non. Unless until we ensure the mental health of the employees, they will not be able to give their what I call best. Now, what is the best way of what I call ensuring mental health of employees? Provide an open and supportive culture. A culture or environment where people can freely what I call express their doubts, what I call seek opinions and also what I call support. That's why. So what more to be done? Number one, let the workplace structures support mental health what I call initiatives. We must listen to the people and put their what I call mental health needs first. Gone are those days when we used to say that the purpose of the business is to what I call make profit. From that we move to what I call triple bottom line. Today we are talking about taking care of multiple stakeholders. So when we take care of what I call overall well-being of the people by taking care of their physical as well as the mental health, they give their what I call best. So for this, probably the concerned managers what I call need to be what I call trained so that they can listen attentively and be empathetic in their approach to help their what I call employees. So for this, the prime requirement is have a culture of open conversation. Allow the people to what I call speak, express these things. Provide child and elder care benefits. Now, when you provide what I call health care benefits and take care of the mental well-being of the what I call dependents, children as well as the parents, the employee will be what I call induced to give his best. Have flexible what I call schedules. Encourage formation of employee resource groups wherein people could connect with their peers and what I call seek required support. And have high quality care for what I call dependents. So we understand that employees' mental health is a what I call must if the organizations have to what I call flourish. So why not what I call start a dialogue, add what I call more benefits, and what I call offer required resources. So let us start the what I call begin the journey of what I call creating an environment wherein we take care of employees' mental health, employees' what I call mental well-being, whereby they'll be induced, they'll be inspired to give their best. Thank you.